This is a presentation on the history of medicine in Kings County, Nova Scotia, 1760 to 1960, 200 years of the history of medicine in that county. Kings County was settled in 1760 by settlers from Connecticut and Massachusetts. When people ask me about the history of medicine anywhere, but particularly in Nova Scotia, they want to know the answers to such questions as, well, who were the medical practitioners in Kings County? Where did they get their training? What training did they have? There's a belief by some that medical doctors didn't have much training at all in the early years. That turns out to not to be correct, as I'll show during the presentation. What diagnostic methods did they use? There were very few, actually, as we'll find out. What infectious diseases were prevalent in the county, Kings County? How did medical practitioners treat disease and illness? And how was mental illness treated during this time, during that 200-year period? And who was responsible for establishing all the hospitals that have been established in Kings County? And we'll find out in this presentation. The first doctor really to arrive in Kings County was Dr. Samuel Willoughby. He comes in 1761, and he was from New London, Connecticut. As was common at that time, doctors apprenticed to an older medical practitioner, which Dr. Willoughby did in New London. There were no medical schools in the United States when he was a young man, so he didn't go to medical school. He apprenticed and learned to be a medical practitioner from an older doctor. He was one of the original grantees in the Cornwallis Township in Kings County. Cornwallis Township is the area across the river on the north side opposite Wolfville, and it takes in places like Port Williams and Harborville, Stars Point, and so on. Well, Dr. Willoughby was pretty active. He not only practiced medicine, but he served as the member for Kings County in the House of Assembly on two different occasions, in the 1760s and the 1770s. He also was appointed a Justice of the Peace for Kings County, 1764, which meant that he could perform marriages, he could do various things, sign various documents, authorized by the government. He petitioned to have a bridge built across the Cornwallis River in 1766. If you go down to Wolfville and go over to Port Williams, you have to cross a large bridge. And this is the bridge that he originally petitioned for, and it eventually was built. He was appointed a Justice of the Inferior Court of Common Pleas, so he became a judge. And he also was a school trustee in 1770. So you can see he was very active in addition to being the earliest medical practitioner in the township. Now, another early doctor was Isaac Webster. He was born in Connecticut. He apprenticed in Mansfield, Connecticut. His uncle, Abraham Webster, was one of the original grantees in Cornwallis Township in 1761. And he got his nephew, Isaac Webster, to come to Cornwallis Township to practice medicine. Isaac Webster also became a schoolmaster. As was common at that time, doctors couldn't really make enough money being a medical practitioner because most people couldn't pay anything for treatment. So doctors would frequently take on another job, schoolmaster or whatever. He became a lieutenant in the Kings County Militia, which was very common again for doctors because every militia unit had to have a doctor or surgeon. He had 9 children, including 2 sons who became doctors. His daughter Harriet married the famous Dr. Abraham Gesner, who eventually was the discoverer or inventor of kerosene. He was also a medical doctor, but was more interested in geology, so that he did a lot of geological work in New Brunswick in particular, and eventually gave up being a medical doctor and became a geologist for the New Brunswick government. Here is the oldest doctor shingle that exists in Canada, and it's the shingle for Dr. Isaac Webster. calls himself a surgeon and a physician. And this shingle is in the hands of one of his descendants and is extremely valuable from a historical point of view. That would have been at the end of his driveway or his lane going up to his house in Kings County. And in the top center, you see sort of a painting which shows Dr. Webster with his Masonic apron on, as well as a lion in the background, the lion being the symbol of the medical profession. And although you can't see it, his left hand is in a mortar and pestle, which was, of course, used to mix their medications. And it's quite a unique painting that he had on his shingle. And so we were very pleased to be able to get a photograph of it. One of his sons was Dr. William Webster. He practiced in Kentville for the best part of 40 years. He did his degree in New York in 1824, and then he went off to London to attend St. George's Hospital Medical School. Most of the hospitals in London had medical schools. So he attended the medical school, the hospital medical school, and then wrote the exams in Edinburgh to become a surgeon. LRCS is a licentiate of the Royal College of Surgeons. Returns to Nova Scotia and becomes surgeon of the Kings County Militia and health officer for Kings County. He was one of the founding members of the Medical Society of Nova Scotia in 1854. He also became a member of the legislature, serving for Kings County from 1855 to 61. He's one of the people responsible for setting up our Anatomy Act here in Nova Scotia, which would allow physicians to do autopsies on patients. Before that, it wasn't allowed. And he convinced the legislature that it was very important that doctors have a chance to do autopsies with the permission of their family in order to find out what caused the death and also to train their students in anatomy. He had 4 children, including 2 who became doctors. Another early doctor, Jonathan Borden, was a physician-surgeon at Kennard. Now, Kennard is between Port Williams and Canning in a very nice agricultural area in Kings County, probably the best agricultural area in Nova Scotia. Beautiful, beautiful, beautiful soil. Anyway, he was born in Horton Township, which is where Wolfville is. He studied in New York, did his MD finally at Harvard, practiced first at Londonderry up in Colchester County, but then moved to Kennard, and he became the coroner for Kings County. At that time, young men who wanted to study medicine had to first of all go into an apprenticeship, and they did that with a practicing doctor, and Dr. Borden had at least 10 of these apprentices study with him before they went off to do their degree at a medical school. He was Commissioner of Schools for Kings County, fathered 3 children, including Sir Frederick Borden, who also did his MD at Harvard, and he was the Minister of Defense for Canada from 1896 to 1911 and was knighted by King Edward VII. Dr. Elias Nichols Pezant was a physician at Lakeville and later at Wolfville. Born in Wilmot, which is in Kings County, an apprentice to Dr. Brown in Wolfville, and then he went up to Philadelphia to do his medical degree. As was common at that time, there were no dentists around at that time, so doctors, medical doctors, also practiced as dentists. In fact, they made not much money doing it, usually 50 cents a tooth or $1 a tooth for extracting a tooth, but still it added to their income. He fathered 11 children, including Dr. James Pezant, who studied in Baltimore and got his degree in 1884. Dr. Pezant died in 1925. Now, at that time, when these doctors were practicing, medicine was in its infancy, and all medicine was being practiced in two ways, either allopathic, in other words, all pathology or all diseases were treated the same, or using alternative therapies, which I'll talk about later. With allopathic medicine, the approach was to try to remove the contents of all the chambers of the body and then rebuild the body. And the idea being that if you got rid of the contents of the intestines, of the stomach, of the urinary bladder, and reduce the amount of blood in the person's body, that you'd probably get rid of the disease that was causing the problem. So the treatment used mercury-based cathartics to evacuate the bowels, and then emetics to induce the person to vomit and get rid of what was in their stomach, and then diuretics to get them to empty their urinary bladder, and also to do venesection or bloodletting to get rid of quite a bit of their blood. The problem with this, of course, is that at this stage they had no idea what was causing the problem. They didn't know what the disease was, and they had no idea how to treat it, so that they were treating every disease the same way. And it actually was very, very depletive and caused the person to almost faint after all of these things were done to them. So if they survived, they almost were treated as being a hero. And it got the name of heroic therapy after a while. And as a result, some people decided, no, I'm not going to put up with that. I'm going to transfer and go to the alternative therapies. And there are quite a few of them, as you can see here. Thomsonian, which was based on lobelia, a plant called lobelia, which if you took some of the lobelia, it would cause you to sweat a great deal. And the idea was, the theory there was that if you sweated, you'd get rid of the disease. Then there was all kinds of herbal medicines, of course, as there still are. Hydropathic, that is using water, particularly mineral water. It was thought that mineral water, particularly the calcium in mineral water, would cure the disease. Then there was hypnotism or mesmerism. There was also homeopathy, which again still exists. And there was various forms of electrotherapy. Now, electrotherapy was useful in that, of course, the idea with electrotherapy is to use the electrical voltage to treat paralysis. Applying the electrical voltage to muscles and nerves causes them to contract, and that causes the area which is contracting to sort of ask for more blood supply. And when that happens, of course, you get nutrition brought into that area of the body, and that does have a positive effect. But it was pretty, let's say, crude, both the allopathic and the alternative therapies. So it took some later developments to improve things. Now, at the same time, the medical diagnosis was pretty limited, because we don't get what we know is the important types of measuring equipment introduced until quite late in the 19th century. The stethoscope was invented in 1816 in Paris by a man named Laennec, a young doctor. But the problem was that it was very difficult for people to use unless they were given some description of what they were supposed to be listening to when they listened to a stethoscope. A stethoscope does produce a lot of what you would almost call noise, but with some sort of guidance, you can identify what the noise means. For instance, it would tell you whether a valve was opening or whether it was closing, or whether the muscles in the lungs were able to cause inspiration or not. So in other words, after a while it was useful. But it took about until 1840 before the stethoscope became used by most doctors. And of course the microscope came in 1830, which allowed you to see disease, although nobody really identified the disease until Louis Pasteur started to identify bacteria through the microscope. And the disorders of the eyes using the ophthalmoscope came in 1851. The thermometer, the clinical thermometer, came in 1869. It's quite surprising that doctors were not using thermometers before that. They were simply, let's say, touching the forehead or some part of the body to see if the patient was hot or not. But it wasn't until 1869 that the clinical thermometer came along, and so they could get a reasonably accurate measurement of the person's temperature. Measurement of blood pressure came along in 1881 with the sphygmomanometer, and that was a great advance because we could find out something about the condition of the heart. And then the X-ray in 1895, the electrocardiogram in 1896, and then finally in 1901 we get blood grouping. And after that, of course, we get a lot of work done on blood transfusion. But transfusing blood without knowing the blood group of the donor and the recipient was a pretty dangerous thing to do. It wasn't until blood grouping came along that that could be done efficiently and adequately. The whole idea that there were germs in the air and that those germs constituted what we call now bacteria and cause infection of wounds didn't come along until Louis Pasteur made the observation using his microscope. So he made that observation in 1867, but it took him many years to try to convince people that in fact he was looking at something that was alive, that in fact was something he called bacteria, and that it could infect surgical wounds. And it wasn't until Dr. Joseph Lister in Edinburgh decided that Pasteur was correct that we get the method of preventing these microorganisms or germs from causing suppuration and putrefaction of wounds, that is, creation of pus at the wound after the operation. And again, those were rejected by leading physiologists, surgeons, and medical practitioners in England and France for about 10 years before people started to believe that that was in fact correct. It's hard to believe now that they would take so long for people to recognize that this was a major, major discovery. 10 years later, in 1877, we have Lister and his student, Dr. John Stewart, who was a Nova Scotian who was studying with Lister. They went down to London to try to convince the surgeons there, and London had hundreds of surgeons, try to convince them that in fact they should be using antiseptic surgery in the form of carbolic acid in order to eliminate or prevent the microorganisms from causing infection of wounds that they were created when they did surgery. So very important. One of the most important things that happened during the 19th century in medicine was the work of Pasteur and Lister. So now that medical scientists are starting to understand there is such a thing as bacteria, they start to try to find if there is a bacteria that causes cholera, or tuberculosis, or diphtheria, or scarlet fever, or trachoma, or typhoid fever, or whooping cough. And of course, during the 1880s, as you can see here, there was a tremendous amount of work that was going on, particularly in Germany and France, to try to identify these bacteria, which are called bacillus. And Robert Koch, for instance, in Germany, he discovered the bacteria that was causing tuberculosis, and also that was causing cholera, and he got the Nobel Prize. And I get the Nobel Prize almost 30 years later or 20 years later, but that doesn't matter. He eventually got it because he had made such an earth-shattering discovery. Tuberculosis was the major killer of human beings during that period. We also have other types of infectious diseases, typhus fever, and of course measles and smallpox and so on. Those are viral diseases. So all of this happened except for smallpox, which they had a vaccine for smallpox as early as 1796. But other than smallpox, all these other diseases had to wait until people started to understand that there was such a thing as bacteria or a virus. Very little was known about the virus. So after this was known, we get doctors practicing in Kings County who are, let's say, practicing scientific medicine, that is, medicine based on science rather than simply hearsay. such as considering that all diseases are allopathic. Dr. DeWitt was born in Bridgetown, studied Dalhousie for a year, but then went off to Harvard to finish his degree. That was quite common at that time. Practiced in Chester, then he went to Halifax. He became the city medical officer for Halifax. He was here during a major diphtheria epidemic of 1890-91. He then moved to Wolfville, served as mayor, and was health officer for Kings County, and later on established a sanatorium for patients with pulmonary tuberculosis in Wolfville. In fact, at that time, there was no, when he established his sanatorium, there was no sanatorium in Kentville. So he was the earliest one to actually isolate TB patients, and he had his own sanatorium, as we'll see later. His son, Dr. Avery DeWitt, was a surgeon and physician in Wolfville. He graduated from McGill in 1990, and he did a lot of postgraduate studies in Germany, and mainly in Germany and Switzerland. He was director of medical services at Camp Aldershot during the First World War, and then during the Halifax explosion, he established a hospital in Truro. At that time, Truro didn't have a hospital, but when the Halifax explosion took place, they had to transport a lot of the injured outside of Halifax because they didn't have facilities within Halifax to look after the injured, so they established through Dr. DeWitt an emergency hospital in Truro. And he did a very important thing by, he spent about 10 to 15 days in Truro looking after the injured from the explosion. He then went back to Wolfville, and because there was no hospital in Wolfville, he established his own hospital called the Westwood Hospital in that town, and operated it from until 1930, when Wolfville actually established another hospital. Another important person in the history of medicine in Kings County is Dr. Arthur Miller, who was the superintendent of the provincial sanatorium in Kentville for almost 40 years. Born in PEI, graduated from Dal. He contracted TB while he was a medical student. He graduated though, and then he went down to a sanatorium in New York, a famous Saranac Lake Trudeau Sanatorium in New York, and he was there for about 4 years, and he was being treated, but he was also a resident physician there and learned quite a bit about how to treat TB. So when they opened the Kentville Sanatorium, he was asked by the provincial government in Nova Scotia to come back from New York and be the superintendent. And as I say, he was the superintendent for about 38 years. Well, there were quite a few hospitals established in the county, and I've listed them here chronologically. The sanatorium started by Dr. George DeWitt in 1902, then the provincial sanatorium of 1904, which Dr. Miller became superintendent of later on. Then the Westwood Hospital established by Dr. Avery DeWitt, and then the West Kings Memorial Hospital started in Berwick in 1922 in the western part of Kings County. Then we have the Kings County Poorhouse and Asylum at Waterville in 1922. In all the counties of Nova Scotia, at that time, there were poorhouses for poor people. There was no financial support at all at that time for anyone who was down and out and poor. So that if, for instance, a young couple had children and the husband was killed, say, in an accident in a sawmill, then the mother didn't have any income and no support, possibly. She had possibly 2 or 3 children. There was no place for her to go but into a poorhouse. And so the poorhouses, every county had 1 or 2 poorhouses, and they were filled with not only young widows, but also people who had mental illness. And so if you visited a poorhouse, an asylum in, say, 1920, you would find that there were all kinds of people from all types of lifestyles in the poorhouse, and it really wasn't a pleasant place to visit. It was called both a poorhouse and an asylum because it contained paupers or poor people as well as patients that were mentally unstable. And unfortunately at that time there was no treatment whatsoever for mental illness, nothing. So that people just sort of lingered on until they died within the asylum. 1927 they came up with a mental hospital, but still, until the various medications came out in the early 1950s to treat mental illness, there was no treatment really of any kind that was effective. Then we get the hospital called the Eastern Kings Memorial Hospital, established at Wolfville in 1930, and then the Blanchard Fraser Hospital opened in Kentville in 1938. We have a lot of hospital activity in Kings County, probably the most of any county outside of Halifax. So just to show you some of the information about these hospitals, this was the advertisement that Dr. George DeWitt put in the newspaper, the Wolfville Highlands Sanatorium for the accommodation and treat of incipient consumption. Of course, consumption was the early name for tuberculosis. It was called consumption because the disease actually consumed the muscles in your lungs, so that eventually you got to the point where you were hyperventilating and you couldn't actually get enough air into your lungs because they were so weak that you simply died from asphyxiation. Anyway, this is the sanatorium advertisement. Now, when we come to the provincial sanatorium in Kentville, there's a picture there. It's quite a large facility. In 1904 to 1909, it only had 18 patients, and it was looked after by a registered nurse. 1909, Dr. Miller comes along and as medical superintendent. They enlarged it in 1918 to accommodate 50 patients, and they built a second infirmary or hospital in 1932. Dr. Earl Hiltz became the medical superintendent in 1947. Now, it turns out that in 1946, a drug came along called streptomycin, which was discovered in the United States, and it was a major breakthrough because you could use that drug to treat TB patients, and it was very effective. Also, you could use that drug to prevent people from getting tuberculosis. So streptomycin was a major breakthrough and meant that eventually the sanatorium in Kentville closed because patients didn't have to go to a sanatorium if they were discovered to have TB. They could be treated at home with streptomycin. The Western Kings Memorial Hospital was established from money left by Samuel Chute, the Apple King, and equipped with a Ladies' Hospital Aid Society, designed by the famous architect in Nova Scotia, Leslie R. Farren. He designed practically all the hospitals in Nova Scotia over 30 or 40 years. First nurse was Mina Neely, and they established a school of nursing there in 1924. And it lasted for about 10 years. Most of the hospitals eventually had a school of nursing because obviously it provided not only the training of the nurses, but it provided nurses for the hospital. In most cases, these nurses in training were not paid, so it was almost like free labor, but the young women were getting training. Then we go to the Eastern Kings Memorial Hospital in Wolfville. That building is still there, and it was established by two families in Wolfville, the Boggs family and the Chase family. The Chase, William Chase, was the Apple King in the eastern part of Kings County, and he donated a large amount of money for this building to be built. Also, donations came from Wolfville and Acadia University. The Blanchard Fraser Hospital opened in 1938 with 45 beds. established by a man by the name of Milne Fraser, and he requested that he wouldn't give the money unless it was named after his wife, Jessie Blanchard, and so that's why it's called the Blanchard Fraser Hospital. There had been a major donation by George Culkin, who was a businessman, and he donated the money to actually buy the land. Now, the Kings County Poorhouse and Asylum, it's quite a big place, and it was always associated with a farm. So you'll see the barn on the right-hand side. They grew their own crops, their own food, and a lot of the paupers, the poor men in particular, worked on the farm, and the women paupers, they worked inside preparing meals and cleaning up the place, of course. In 1922, there were 55 people in this poorhouse and asylum. The mental hospital, which opened in 1927, had 58 patients, and it lasted until 1962. It was a reasonably modern building, as you can see. So I guess that brings it to an end, and I hope that you've enjoyed hearing about the history of medicine in Kings County. Thank you.